One of the hottest topics on my social media feeds is public health and the COVID-19 pandemic. There's been arguably a qualitative change in the way public health officials in this country are now managing or not managing the pandemic. And people are kind of wondering what's going on. And so I'm going to talk to Dr. James Talbot, who is a former Alberta Chief Medical Officer of Health, the position now occupied by Dr. Dina Hinshaw, but he's now an adjunct professor at the Faculty of Public Health at the University of Alberta. So welcome to the interview, James.
Thanks for having me.
Look, I want to read a quote from an interview with Dr. Mark Lyshyn, who's the medical health officer with Vancouver Coastal Health Authority here in British Columbia. And this is what he said, or part of what he said, in a CTV interview on July 18th. He said, BC has, quote, shifted from a collective responsibility to protect the population to an individual responsibility for people to protect themselves, unquote. Now, James, I always thought that public health was about a collective effort to stop transmission of diseases in the community. So to me as a layman, this seems like a sea change in public health policy and philosophy. Am I right or am I wrong?
Well, I think you're right that public health has always been about the organized effort of society to make sure that as many of us are safe as possible. And I think that in what you read might indicate a change in policy, or it might be that they just got the emphasis a bit wrong. Because of course, in all public health issues, there's room for both individual responsibility, community responsibility, and government responsibility. As I used to say when I was talking to communities about the individual responsibility around fitness, it's okay for me to go around telling parents that their kids need 30 minutes of exercise every day. But if that child lives in the inner city and it's not safe to leave their house, then the community and the government have to step up as well.
Sure, but let's go with your metaphor here, your analogy, because from where I'm sitting, it looks like the government and public health has now shut down the playgrounds, closed the arenas, locked up the baseball diamonds, shuttered the school gyms, and then said, "You're on your own, folks. There you go, individuals."
Well, I don't follow BC as closely as I should, but I'm hoping that that's not what they're saying. What I would suggest is that what they're saying is that there is still room for people to make good decisions about, A, should I wear a mask? Should I go to this crowded gathering? If I have somebody that I live with who is immunosuppressed, shouldn't I make an extra effort? Should I make sure that myself and the people in my family are fully immunized? But at the same time, you want to make sure that the government and communities are making it possible for people who decide that they want to wear masks to have access to those masks, that if they want to know how much virus is circulating in the community, they're able to get that kind of information. As new vaccines come available that have Omicron, that are optimized for Omicron, that people are made aware of how and when they'll be able to get that, and that the vaccine is provided free of charge to make sure that we don't end up creating a barrier for people who are poor. So I would hope that BC is still going to continue to maintain that kind of community and government effort.
Now, James, I used BC here as an example because it's one I'm familiar with, and that's where Dr. Lyshyn is located. And it was a useful quote. I think it's neatly summarized what I was getting at. But as far as I can see, this is mostly what's going on across Canada. And it certainly seems to me, because I, have report on Alberta and have friends and family in Alberta, I pay attention there. And it seems very similar to what BC is doing. And it's like, okay, we gave you vaccines. You want to wear a mask? Go ahead. That's it. We don't have any more we don't have any more vaccine mandates. We don't have any mask mandates. We don't have any restrictions on travel or gatherings. We literally have nothing except for vaccines and advice. And we don't even, like in BC, Alberta's a little better on the data side. BC deliberately suppresses data, don't provide data anymore. And I've had arguments with physicians online on social media saying, well, you want me to do a risk assessment? I haven't even got data. about the province or my community to inform my risk assessment. And so I wouldn't argue that the governments have pulled back 100% from the collective responsibility of public health, but I would argue it's a very large percentage compared to what went on early in the pandemic, and what seems to be needed now. People are still getting sick and dying, and our healthcare system is at a collapse. And I apologize for the rant, but this is, I think there are a lot of Canadians who are really wondering what the heck is going on here.
Yeah, I don't think you should apologize for the rant. I think the more this kind of discussion happens in public and more we hear from all the sides, and the more that it's guided by science and passion instead of ignorance and passion, the better off we are. So I wouldn't apologize. Compared to the lockdowns that were necessary when the original strain of COVID, as fatal as it was, with as much as we didn't know about it, was around and killing people, and we didn't have vaccine, and then we weren't sure that if we got a vaccine it was going to work, we're a lot better off than we were, and the restrictions are a lot lower. But let me highlight some places where I would hope the government is still paying a lot of attention to what's going on. First of all, in seniors' homes or any kind of homes where you have a congregation of people who are either chronically ill or older, I would like to make sure that they're continuing to ensure that the caregivers are immunized, that those places, the ventilation and filtration are top notch, that staff are aware of all the infection control that they need to do, and that when we get to the fall and kids are back in school and we see another swing with COVID, that they're prepared to restrict visitors coming in to ensure that anybody who's symptomatic can't come in. So there's one high priority area that I'd like to think they're still working on. I'd like to make sure that governments are making it possible for all the people in this country who work to be able to stay home from work if they're symptomatic or if they test positive. So, there are a large number of people in the country who have sick leave and are able to make that choice. And lots of companies who are telling them, if you're feeling sick, stay home, don't infect other people. But there are a lot of people, the people we depended on throughout all of COVID, on the front lines who are on hourly wages. And depending on where you are in this country, the choice you may have is going to work feeling a little bit sick and potentially infecting customers or fellow workers, or not providing for your family. So, these to me are the high priority items. And then, as I've said, for individuals, I'm still going to be taking a hard look at where I wear a mask and where I don't wear a mask, and what kind of conditions there are in the community, and what kind of place I'm going to. Is it going to be crowded? Is it got good ventilation, et cetera? Because I have no desire to get COVID even in its weaker form.
Okay, well, FYI, we just got some data on COVID deaths, and in 2022, they are now double 2021 in British Columbia, because of Omicron. So clearly deaths have not gone down. We know that the BC health system is on the verge of collapse, if it isn't already collapsing, as it is in Ontario, and it's in big trouble in Alberta because of the burden of COVID patients and because of sick healthcare workers and burnt out healthcare workers. This is a crisis that screams out for intervention. And I haven't paid 100% attention to Dean Hinshaw's comments, but I know Bonnie Henry has still not acknowledged that the primary means of transmission for infection by COVID-19 is airborne, which then leads, you mentioned ventilation and filtration and masking and all of those things. There's not even messaging about that. Never mind interventions. When I was, not that long ago, 3-4 months ago, whatever it was, when we had a mask mandate in BC, when we went out to the grocery store once a week, everybody had a mask. Now nobody has a mask. Maybe 5% have masks. Well, clearly people aren't making great decisions, because we're now on the cusp of, we're into the 7th wave, the 3rd Omicron wave of this pandemic, and people are making decisions as if they believe that the pandemic is over. It seems to me, I'm sorry, James, you're the expert here, but are we not in the midst right on the cusp or into a major health crisis in this country?
Well, you covered a lot of territory, and I don't know that I can do it justice. The problems with primary care in this country go back decades, and underinvestment of governments in nurse practitioners, in primary care physicians, family docs, is a longstanding problem. And I know BC has been particularly vocal about the shortfall and the inability of people to get to see a family doctor. Has COVID made that worse? Yes. Does it mean that there is a likelihood sometime in the fall, when kids are back in school and transmission ramps up again, that public health is going to have to look seriously at reimposing measures like masking in public places, masking in during public transport? Yes, I think that's a very real possibility that it will have to go back to that. Similarly, the people who are dying, at least in part in this country, it's because of their inability to get into ICUs. And we run lean in ICU beds compared to the United States, and the United States runs lean compared to Europe. And once again, that is a decision made by provincial governments and, lesser extent, federal government funding that goes back a long ways, and which needs to be revisited as well. The one thing I would disagree a little bit with, I know the federal government has looked at and made grants available, and the Ontario government, I believe, as well, to facilities to test their mechanical and filtration systems and to get funding to upgrade them. So that is something that at least parts of the country are looking at. And I agree with you, we need to do a lot more of that, because that's something that will pay off both for viruses entering immunosuppressed populations, but it'll also be good in case there are fires, large fires in the vicinity, and those same vulnerable people have to shelter in place, whether it's a hospital or an old age facility of some kind. So I don't know that I did justice to the range of what you did, but I do share your concern that if things continue this way, government's going to have no choice but to ask people to go back to the things that we know will help slow the spread of COVID.
Now, I interviewed you last October, and boy, you were critical of the Jason Kenney-led UCP in Alberta. And you said so very specifically that you thought the government was following the Great Barrington Declaration, which is basically just let her rip and let the virus run through, roughshod through the population. But I would put it to you that in fact BC hasn't been much different, and essentially has followed Alberta, or Hinshaw and Henry say they consult each other all the time. In fact, the four provinces, the CMOs, consult each other all the time. So there's clearly a coordination of policies around this sort of thing. So if you thought, 8 months ago, 9 months ago, that the Great Barrington Declaration was motivating the Alberta government, what do you think now?
So to revisit last summer, you may remember that the Kenney government announced that it was to be the best summer ever. They had gotten rid of all of the control measures before any other province had done so. They did so while the emergency departments were under killing stress, as were the people who were staffing ICUs. ICU beds at that point were not overcrowded, but it was clear with the exponential growth that was happening that was just a matter of weeks before that started to happen. And the government was telling people if they tested positive, there was no need for them to self-isolate. So that, as bad as the Barrington Declaration is, this was worse. It was turning its back on the science and the situation that they were facing. And more than 1,000 Albertans died past that point. because of that decision. The other reason that we were very unhappy at that point was it was undermining the message that the government was trying to get out, that people needed to immunize. And so Alberta immunization was lagging behind the rest of the country. So it was something to be concerned about, because it was getting both sides of the equation wrong. So where we are now is different in the sense that a vast majority of people have been immunized. They are protected against serious outcome. The government is continuing to press to ensure that people get boosters to reduce that even further. So that's one thing that's changed. The second is that we were still looking at Delta back then, and Omicron is less of a concern. But there's no question that after 2.5 years, over 2.5 years of pressure on the healthcare system, that it is under enormous stress. The question is, are the people out there prepared to go back and make the changes in their behavior that are necessary to bring this and subsequent waves under control? And I think government is going to continue to take a look at those numbers in the fall, and may in fact have to make those hard decisions.
Now, there's an interesting debate within your community, because we've seen many of I follow a lot of doctors and infectious disease docs and epidemiologists and so on social media. And they say one thing, and then you have scientists in related fields like aerosol transmission specialists, who sometimes are engineers, for instance, and they're saying, look, there's so many easy, simple, inexpensive things we can do. We can put HEPA filters in every classroom. We could have HEPA filters in our home. We can make sure that our ventilation is done. Government could put some money, make sure all the schools their HVAC systems are operating properly. We can have stronger mask messaging. Literally, people now think that the pandemic is over, that it's not a threat anymore. No, it's no wonder they're not wearing masks. So we could have mask messaging. It's not a mandate. It's just simply, here's information. What about data? What about PCR testing that could be brought back? There's so much government could do, so much public health officials could do that doesn't cost. It isn't that intrusive, that would give people more information, more tools to manage their health during a pandemic. And we're not even doing that. Now, as a public health expert, what's your take on that?
Well, two things. The first is that my entire career has been dedicated, and my research dedicated to the idea that when people are given better quality information, they make better quality choices. And so I think the surveillance data and making it available routinely to people is something that should happen routinely. I think that we now have really great data on what's happening in COVID and sewer systems to give people an idea whether things are getting better or worse. We have the ability to follow everyone who shows up in the emergency department. I have zero difficulty with the idea that those should be published regularly and routinely so that people can make good choices. The second thing that you brought up was masking. I honestly thought after the first wave, when people were dying, that we would see a behavior change so that there would be people who understood that A, if you're symptomatic, you shouldn't go to work. B, if you're symptomatic and you're staying at home and you have family at home, you should be wearing a mask. And C, if you go out in public and you're symptomatic, you should wear a mask. And I can't see any reason why that shouldn't be part of our standard way of dealing with things going forward. And as I've already said, government has a role in making it possible for people to stay home from work and stay home from school. And I would tie that to hand washing. How people would start to relax hand washing at this point makes no sense to me at all. And I guess the third thing I would say, although I said two to start off, is that I think that there's the debate about the importance of ventilation and filtration has already been decided. I think the answer is Droplets are the way that most of the transmission occurs, but significant transmission can occur in enclosed spaces with poor ventilation and poor filtration because of aerosol droplets. And so we need to stop this fight between this false dichotomy that it's one or the other and start doing exactly what you said, taking a common sense approach and saying, you know, if I'm I mean, you already see this happening because people who own businesses are pretty smart about this stuff and they've learned what can happen when they don't pay attention. But if you're a gym owner and you have a great big gym and it's got lots of air exchange and it's not very crowded even at peak times, you're probably reasonably safe. But if you're running a spinning class in a small area with not much in the way of ventilation, you better get a mechanical engineer in there to take a look at air exchange and filtration, because if you're not going to be able to tell your clients that they can work out safely, you're not going to have clients. And obviously, as I've already said, hospitals need to be looking at this. Long-term care facilities need to be looking at this. Any kind of homes that have people with chronic illness or immunosuppressed should be looking at this. So I agree with you. Like, I think that debate needs to stop being you're right and I'm wrong. And look, let's use common sense and start with the people who need the most protection and just keeping steadily working at that.
Well, my takeaway from our conversation, James, is that, I mean, we haven't talked about whether there should be or shouldn't be a mask mandate, should be or shouldn't be a vaccine mandate. That ship has sailed. What we're talking about now is the role of public health and the role of governments in doing things like you just described. You know, providing data, helping businesses and schools and public buildings and so on have better HVAC, all of the plethora of things that could be done at a reasonable cost that isn't likely to provoke a backlash like it did early on in the pandemic, which politicians and public health officials didn't like very much. And yet we still are not doing it. And there's so much more to be done. And two things, people's health is being affected. Long COVID is something we didn't know about 2 years ago that we now know a lot more about. And secondly, the healthcare system. That just seems to be like that ought to be an all hands on deck kind of response to these pressures and stresses that are on the healthcare system. And that part of that all hands on deck, one of the hands ought to be, a big one ought to be public health. We're doing all these things that we've talked about. Is that fair to say? Is that, you know, we're just not doing enough and we need both government, public health, and individuals to do a whole lot more?
Oh, you know, if there was ever a place for a royal commission to be put together with a mandate to look at how to strengthen every part of Canadian society to be better able to learn the lessons from this and that we're continuing to learn and to be better able to handle the next one, this is the place for it. I mean, we've covered some of it, but you know, there are weaknesses in our ability to access vaccine because we had no vaccine manufacturing capacity within the country. People couldn't get enough hand sanitizer. They couldn't get enough actual masks that would protect them. I mean, there are a whole series of things that if we're to learn what we need to learn for the next time a killer virus escapes from Asia or Africa or Alberta or, you know, South America, then as it stands now, we haven't done nearly enough to study those and rapidly put together some common sense things that would say, you know what, if it were to come 2 years from now, we're actually in better shape than we were.
Well, before I let you go, then we need to talk about that timing, because you say the next virus, we're not even close to being out of this pandemic. I mean, we're now in the 7th wave, led by Omicron BA.5 variant, which looks like it's going to be the most, I've heard it described as the most transmissible virus we've ever seen. God knows what's coming after that, because these variants just never seem to end. And so what do we do in the short term? I mean, while the Royal Commission is off doing its work, assuming we had one, we still might have a year or 2 or 3 of being in this pandemic. What do we do?
Yeah, I think there's nothing to stop people operating at an individual level, a city level, a provincial level, and a national level, from asking, what can we do in our organization? What can we do in our city? What can we do in our province from what we've learned so far? And we're blessed in this country with a pretty amazing academic system, and it would not take very much to get academics together along with decision makers and the general public to say, look, we want to be better prepared the next time, and what are the top 3 things that we should be working on this year? And, take a look at how, as you said, COVID is still going. So you put those measures in place, you check to see how they work against influenza, how they work against COVID. And next year you reconvene and you come up with another 3. It doesn't have to be a massive amount of money and thought go into it if we test these things and implement them in small pilot projects, and then as the pilot projects work, expand them. What's required is, as you're saying, the understanding that we did okay on this one. Frankly, compared to the rest of the world, Canada came through pretty well, but we can do better. And if we don't take this opportunity to learn and change what we do, the next time we might not do so well.
Well, James, before I let you go, we need to put a bow around this conversation, but I don't think we did a good job. I'm sorry. I think we dropped the ball a lot. And one of the reasons I think that is because there are vocal critics in the medical community in Alberta, people like Dr. Joe Vipin, they're his equivalent in BC, though fewer of them. There's lots of them in Ontario who have made very pointed criticisms about what's wrong with the public health response to COVID-19, what's wrong with provincial government response to COVID-19, and how we should respond so much better to save people's lives and prevent illness. And I agree with the critics. I agree.
I can't let that go unchallenged. Like I know Dr. Vipond, and he is an amazing advocate and a tremendously passionate guy. And he has not been happy with the aerosol versus droplet debate from the beginning. I would submit that is 1/1000th of the response that Canada had. And just to go back to the numbers, because I don't want to focus in on one person or one debate. If you take a look at Canada's mortality, which is, there's lots of issues with it. It's clear that worldwide, some people died of COVID who were never counted, but it's a pretty solid indicator of when things are going right and wrong. That Canada fits in about the top 5th in terms of the least amount of mortality. And we got the first wave right. We stopped COVID in its tracks, which is why most of that mortality didn't occur. So that was the first thing you had to get right. Canada got that mostly right. The second was to try to protect as many people until a vaccine became available. And Canada also got that mostly right. In places like the Maritimes and the North and the territories, they were world class. They were exactly the same kind of mortality rate as we saw in Australia, New Zealand, and China. And the rest of the country wasn't quite as good, but they were way better than the average, even amongst industrialized nations. And then the third was to make sure that you got enough vaccine and you got it in time. And that's where places who were front runners like Australia and New Zealand stumbled, because when they finally got to the point where COVID was being reduced in other countries because of the number of people immunized, places like Australia and New Zealand didn't have enough vaccine, and they didn't have it fast enough. So if you were going to get out of the local perspective of what worked and what didn't work and what we think could have gone a little bit better, and just get a perspective on the big picture, there are very few places in the world you would have wanted to ride out COVID more than Canada. Would you have liked to have been in the United States? No. Would you have liked to have been in the UK? No. Would you have liked to have been in France? No. And God forbid you would have been in Norway. So in spite of the fact that that's one that people point to. So I understand there's room to improve, and I understand that people are very nervous because we came very close to having a full-scale disaster. But that doesn't change the fact that overall things worked pretty well, and we still need to improve because the next virus might not be so forgiving.
James, you and I are going to agree to disagree on that, and I acknowledge your expertise and in taking your position. But I think that's grist for another debate, and one we should have. I would be happy to. I'm not the guy to have it. We should have somebody on who actually is an expert to take that side of the argument. But it should be a conversation that we could have, because that is out of conversation, out of debate. Reasoned, evidence-based debate will come better policy next time, or an improvement on what we have now. Fair enough. Okay, I'll let you go. Thank you very much for this, and always appreciate your insights.
It's a real pleasure. Thank you very much.